I'm Dr. David Beaulieu, and I'm here with more news you can use. I'd like to talk to you about a startling problem that we've got. And it has to do with autistic spectrum disorder drug emergencies, particularly ADHD, that quadrupled in a 6-year period of time. According to a 2010 United States government survey, 1 in 10 American children now has attention deficit hyperactivity disorder, ADHD. That's a 22% increase from 2003. ADHD makes it hard for children to pay attention and control impulsive behavior. About 2/3 of the children diagnosed with ADHD are on some form of prescription medication, and according to data recently released by the Substance Abuse and Mental Health Services Administration, ADHD drugs such as Ritalin, Vyvanse, Strattera, and Adderall, and their generic equivalents, were responsible for nearly 23,000 emergency room visits back in 2011. 23,000. Mike, what are we doing to our children? This is more than 400% increase in ER visits due to adverse reactions to such drugs in a mere 6 years. Now, that's not acceptable. I want to tell you, there is no evidence whatsoever that ADHD or any autistic spectrum disorder is caused by a deficiency of Ritalin, Vyvanse, Strattera, or Adderall. In fact, there are no diseases that we know that are caused by a deficiency of any drug. Drugs treat symptoms. They don't cure anything. They just eliminate symptom patterns. And this is shocking. We're talking about children here. We're talking about 23,000 emergency room visits. Meanwhile, the potential side effects of ADHD drugs are actually quite serious. Obviously, they're causing 23,000 emergency room visits. You've got permanent brain damage. Wow. Changes in personality, depression, and/or hallucinations. Cardiotoxicity and liver damage. Heart attack and stroke. Cancer. Sudden death and suicide. What causes this? What causes this? A lot of things create a problem. They really, really do. We've got kids who fidget, who are restless, who daydream a lot. They have trouble playing quietly. They have problems organizing tasks. They have difficulty following through on instructions. Do you want to see kids like this? It's easy. Go to school the first day after Halloween. And the teachers will tell you the entire class is hyperactive. Do you think it could be the sugar from the candy they ate? Gee whiz, I don't think anybody's paying any attention here at all. If you suspect this or you've been diagnosed with this, here are some things you need to do. Eliminate most grains and sugars, including fructose. Grains and sugars both tend to cause allergies in sensitive individuals. Even organic whole sprouted grains can cause problems in many children. So it would be wise to give them a grain holiday just to see if it improves their behavior. Replace sweetened beverages, including fruit juices. And we'll have something here on YouTube about fruit juices and the amount of sugar in fruit juices. Many fruit juices, it's as much or more than a can of pop. Please use non-fluoridated water. Water should be the #1 beverage, but use non-fluoridated water. Avoid all processed foods, especially those containing fructose, trans fats, artificial colors, flavors, and preservatives. Increase fat in the diet, especially parent essential fatty acids. Very, very important. Clear your house of dangerous pesticides and other commercial chemicals. Avoid commercial washing, detergents, and cleaning products. Use organic, use natural. Spend more time in nature. It helps these kids to get outside and play. It helps them to react with nature. Investigate sensory therapy and emotional wellness tools. You know, one of the things we're beginning to implement in my office is emotional freedom technique. And it's proved to be very, very helpful with these children. You might see if there's someone doing emotional freedom technique in your community. If you have a child who's having these types of problems, these are some of the things that you can do that might really help. Good luck with it.